All right, everybody, we're going to go ahead and get started here. Would like to take this opportunity to again thank everyone that's taking the time out to join us tonight. I know you all have busy lives and schedules, but this is an issue that's very dear to our hearts, and we wanted to share this with you and introduce an organization to you for those of you that are new to it, which is Physicians for Criminal Justice Reform. This is an organization that's been founded by myself and a few other like-minded physicians. I can tell you personally that the reason I felt that this was a crucial issue is, as many of you have seen in the news recently, there have been several reports of unarmed men being killed by the police. The circumstances amongst those are varied, but there has been a common vein of assumed criminality of the individuals that were accosted by the police in pretty much every instance. I had a very visceral response to these incidents. It was something that saddened me, that angered me at times, and I wanted to do something about it. Initially, the only outlet I could think of was going to Facebook and posting articles that I thought were relevant, that addressed the issue in a good way, and maybe came up with some solutions. As time went on, I found that this response was inadequate, that we needed to really do more, that I felt that there was something for me to do. As a physician, I have a certain set of skills and leadership and value to the community that I felt that was crucial and important to be injected into this conversation. But at first, I didn't know exactly how. So I started to reach out to fellow physicians such as Nzinga Harrison, my co-founder, a psychiatrist in Atlanta, Georgia, and Cameron Matthews, chief medical director in Chicago, Illinois, as Osvaldo Gaitan, a psychiatrist in El Paso, who will be able to join us tonight as well. And we started to throw information back and forth, questions about what we thought we could do for criminal justice reform. And it was important to us that we really came up with an organization and a set of goals and objectives that was consistent with us as physicians. We wanted to add something different to the conversation on criminal justice reform. We did not just want to be a rallying organization for physicians that were broadly interested in the issues. And towards that end, we spent a very long time, over 4 months, really sitting down and hammering together what we felt were the very specific issues that we could address best as physicians and how we could help direct the national conversation on criminal justice reform. As we went forward, we finally came up with our About Us statements and our core issues, as well as the strategies that we're going to use to achieve those goals. And that's when we decided to launch. So the organization is now officially 2 weeks old. It's been going great so far, and we wanted to take this webinar as an opportunity to really introduce you to the organization, let you know what those core issues were that we came up with that we felt were relevant for us as physicians and were things that we could really be experts and specialists on, and give you an opportunity to ask us questions, find out how you can get involved. For those of you that are not physicians that are on the call, don't log off. This organization is for you too. We will need you if we're really going to enact a lasting change in this group. And with that, I'd like to introduce you to the About Us that we came up with in the tagline for the organization. So in trying to sum up the organization in one line, we came up with physicians advocating to eliminate the damaging health consequences that can result from negative interactions with the criminal justice system. We wanted to expand on that further, and then we came up with an About Us that would state fully what we thought our mission was, and that was that the organization was founded by a group of physicians who were struck by the myriad of ways that negative encounters with the criminal justice system lead to detrimental health consequences. As members of the organization, we firmly believe that changing the interaction between the criminal justice system and individuals of targeted populations will ultimately lead to improved health of these targeted communities. As such, our members have made the commitment to be leaders of the criminal justice reform by using our medical expertise to, 1, increase awareness and knowledge of the bidirectional relationship between health and the criminal justice system, to serve as a fund of knowledge, education, and training for local, state, and national health and justice systems, and lobby for criminal justice reform around our core issues. And with that, I would like to start introducing you to our core issues. First up is Dr. Nzinga Harrison, who, again, is one of my co-founders. Go back to medical school has always been an inspiration to me as being a leader and advocate. And she's going to talk about our first core issue.
Thank you. So I was having a little difficulty getting myself off mute. So our first issue is the decriminalization of mental health and addictive disorders. What we know is that a disproportionate number of individuals who have mental health diagnosis or addictive disorders diagnosis are, rather than being funneled into a treatment pathway, being funneled into the criminal justice system. What we also know is that once you get in the criminal justice system, it's exceedingly difficult to get out, and that the availability of treatments in the criminal justice system for mental health and other addictive disorders is inadequate. And so rather than being directed down a treatment pathway in the first place, our patients are getting caught up in a system that is really ill-equipped to help them manage the symptoms of their illnesses, get in recovery, and thereby lead meaningful lives as contributing members of society. So what Physicians for Criminal Justice Reform aims to do is to support both the health systems and the criminal justice systems in identifying opportunities for diverting individuals from criminal justice involvement to mental health and addictive disease health system involvement, so as to relieve the pressure on the criminal justice system and make appropriate treatments available to those patients, with, of course, the goal being improved health outcomes and decreased negative health consequences as a result of their interaction with the criminal justice system. Good job.
Just want to thank Nzinga again for our introduction to our first core issue. Again, this is something that we felt was one of the most important things that we could address, and Nzinga, as a psychiatrist in Atlanta, has a lot of experience dealing with patients that have these issues. Next up, we actually had some technical difficulties from one of our other co-founders, Osvaldo Gaitan, who's a child and psychiatric psychiatrist in El Paso, Texas. So I'm actually going to lean on the expertise of Nzinga, Dr. Harrison, again to talk about our second core issue, which is working on the juvenile justice system.
So similarly, I told Dr. Gaitan that I would try to fill his shoes, as he was instrumental in helping us develop this as a core issue for Physicians for Criminal Justice Reform. But what we know is that the goal is, again, diversion of at-risk youth, so that instead they become involved in health and other supporting systems rather than the criminal justice system. What we know is that ADHD goes wildly undiagnosed and puts our youth at increased risk for being involved with the criminal justice system. And once you become involved with the criminal justice system, then there's an inadequate ability to meet those youth needs, but also a lifelong brand that begins to unravel the opportunities that are presented to those youth to become healthy adults later on in their lives. And so by supporting the criminal justice system and the health system in providing education, making sure there's adequate diagnosis, making sure there's adequate opportunity for management, and then for those adolescents that do get involved in the juvenile justice system, minimizing the trauma that is associated with that. There's a significant risk of being sexually, physically, and mentally traumatized when held in custody. So minimizing the risk for that, but also establishing mental health and drug courts for adolescents, so as to provide them a conduit to get out of the criminal justice system into the health system and increase their chances for being able to grow into healthy adults, is the second core issue for Physicians for Criminal Justice Reform. So hopefully Dr. Gaitan will feel that I did an adequate job presenting that issue on his behalf.
Thank you, Nzinga. Again, and Dr. Gaitan was one of those that sat around the initial round table and helped us come up with these points. So with that said, I'd now like to introduce Dr. Cameron Matthews, who will talk about our next core issue, which is looking at the healthcare systems for our currently incarcerated inmates. So Dr. Matthews, I'll let you introduce your extensive expertise in this issue, as we felt that she was particularly qualified both to bring up the issue in the group and also to present it to all of you.
Great, thank you, Eja and Nzinga, really for moving this forward. So our third core issue for the organization is really focused on those persons who are already actually a part of the criminal justice system and actually have already been prosecuted in some format. So that's our current inmates. I have what I consider to be the pleasure of working with the correctional patient population as a family physician, a staff physician at Cook County Jail here in Chicago, the largest single county jail facility in the country, housing anywhere upwards of 10,000 inmates on any given day. It spans a ridiculous number of acres here on the west side of Chicago, and I was fortunate enough again to be the staff doc lead physician for Division 11, which was some medium, some minimum risk inmates, but also worked in the ED there and took care of some of the max gentlemen as well. My personal experience there was enlightening in the sense that there were obvious needs that I could not fulfill as a primary care physician. I mean, I was there to educate my patients. I was there to treat their chronic conditions, a lot of which I diagnosed there in jail that they had no awareness of. But then more significantly, there was the issues that I couldn't deal with, and a lot of that being mental health. We were fortunate enough to have a pretty strong mental health division at that time with some wonderful friends of mine, one of which who is now actually the lead executive director of the entire jail, a psychologist, which is interesting that she's coming from a non-correctional background. But we obviously saw a significant need there that was not being addressed in the sense that our jail system, our jail and prison system, is being used to treat our mental health, our patients suffering from mental health problems, chronic conditions, and of course, keeping them behind bars is in no way any sort of means for treatment, and in fact could worsen their situation as we found on a regular basis. So as a core issue for our organization, we are definitely speaking towards providing adequate access for these inmates there. We did as much as we could as physicians and psychologists and mental health professionals there on site, but obviously there was need for more. There was need for education, there was need for treatment, a lot of which of course should occur before and after they're released, but at the same time, their interaction while they were with us definitely left a lot to be desired. So as a core issue for this organization, we really want to speak to the provision of adequate access to physical and psychiatric health care for our current inmates. And then doing as much as possible to also treat their different social determinants of health that, of course, are affecting their well-being both in and outside of the walls of the jails and prisons. We, of course, as a country, know that we have the highest incarceration rates possible across the world, and that's abominable. It should not be something that we are proud of, and we need to do as much as possible, considering the obvious disparities in the demographics of the inmates that are in these facilities. We need to do as much as possible to make sure that we can impact their well-being from a public health, a population health standpoint. So I'm very happy to introduce this third core issue, and I stand completely behind the organization in trying to bring about equity as far as access.
All right, thank you very much, Dr. Matthews. So those are the three core issues that we put together. I'd like to introduce now Dr. Charles Munyon, who is another colleague of mine. We go back to medical school together. He's currently a neurosurgeon practicing in Philadelphia at Temple University. And I'd like to give him an opportunity to talk about how we really just sent him an email, asked if he was at all interested, and he became one of our strongest backers, and to tell you how you also can back us and help us start supporting our initial campaign.
Well, thank you, Jeff, for the invitation and the opportunity to address the group. As Ed just said, I currently practice in Philadelphia, and actually specifically I practice at Temple University, which means that my population is majority Medicaid. At the main campus, probably 80% African American or Latino, and unfortunately, as we know, that means that the majority of them have had some experience with the criminal justice system. and actually, I also treat a number of currently incarcerated patients who are referred to Temple from the prison system. And the major issue, obviously, is that a huge number of these patients are being tragically denied reasonable access to healthcare services in a way that if you even just take a moment and look beyond the reason for their incarceration, which we can get to that in a moment. The whole point is that if we're to believe in a system that sees incarceration as a vehicle towards rehabilitation, we have to, as a society, take basic care of the people in the prison systems. I also have a strong interest in mental health issues, both from a treatment perspective and just from a sort of societal perspective. I think that the way that we view mental health as a society says a lot about us, and about the way that we sort of judge and value the individuals in our society. And so I think I was very excited to see Edja, who I've known since medical school, and I know to be extremely well organized and very competent guy in sort of all areas, setting up something like this. And I was very happy to see that the core issues identified were things that I think we as physicians can have a real and authoritative voice in. The overlap between addiction and the criminal justice system is something I see in my practice on a weekly basis. The ways in which patients' lives are adversely shaped by their encounters with the criminal justice system is something that the patients that I see are suffering the after effects from 5-10 years down the line. I had a patient actually who unfortunately died as a result of a poor transition of care from the criminal justice system to the outside world. He wasn't sort of taught how to properly refill his prescriptions, and he went into status epilepticus as a result of his brain tumor and not being able to fill his seizure meds, and he went into cardiopulmonary collapse as a result of the seizures. And it was tragic. He was actually getting better medical care in prison than outside. So for all these reasons, I've really felt compelled to want to be involved. And sort of beyond that, I do feel very strongly that as a country we need to really take a good look at how we treat the poor, the underserved, and in particular, I think policing is not the answer. I think expanding services, expanding support, giving people the opportunity to make better choices is the way to go. And so it's for all those reasons that I wanted to be a supporter, and I told AJ I'd love to help out in any way I can. At the moment, that assistance has been sort of purely financial, and I think money is probably the easiest way for most of us to get involved, since time is usually at a premium. But I think just staying in touch with the group, talking it up to your colleagues, that's a big thing that I've been trying to do, is let people know, hey, this is something that's out there. And it's not just another sort of I'm mad as hell and I'm not going to take it anymore group. I think the best thing about this group is really that there are those identified aims, that there are clear plans to address the perceived problems, and that they're all within our bailiwick. It's an achievable scope. It's it's an area that we can, as I said, we can really speak authoritatively on, and so I'm really excited to see where it goes, and I hope that some of the rest of the folks watching this will also pitch in, either financially or with your time, or just by talking it up to your friends. So,
thank you very much, Chuck. I really appreciate your discussing, again, why you got involved, and again, even felt the need to donate financially to the organization. And with that, I'd like to talk a little bit about what we've done since we've launched, which again, our organization has only been live for 2 weeks, but we've already made significant headway. Our Facebook page, which is at facebook.com/pfcjr, which is our affectionate nickname for the organization. Again, that's facebook.com/pfcjr. It already has over 650 likes, again, in 2 weeks of starting the organization with very minimal promotion of the site. Our Twitter feed is up and running. We're tweeting out articles, posting articles on Facebook on a daily basis to try and examine issues around our core issues. We are raising funds for our website and for donation or an establishment of the organization as a 501c3 nonprofit organization. The website is actually nearing completion because Dr. Harrison was willing to front some of the money for the website herself. So we'll be able to launch that shortly, and that'll give us an avenue to start producing our own blogs that talk about the issues, which is our own user-driven original content, as well as start to talk about research and push research, some which is already being done by physicians and non-physicians across the country that look at the health impacts of interactions with the criminal justice system. And we hope in the future to be able to even maybe sponsor some research of our own, to commission research, issue white papers that tell people how we as physicians feel about these issues. Again, the Indiegogo page, the campaign is still live. There are 2 more weeks for you to contribute to the campaign. We are almost at our goal, almost agonizingly close in such a short time, and we'd love for you to chip in whatever you have towards that. We do have PFCJR buttons, T-shirts, as well as fancy professional lapel pins for you at different donation levels, those being 20, 30, and 50. At 50 you get all 3. And we'd love to see you contribute so that, again, we can have the funds to really build the organization strongly. We are currently finishing up writing our bylaws, which will establish the board that will work on these issues and establish both regional and even further local involvement for physicians to lead a chapter of their own to look at local issues, as we know that many of these criminal justice issues are really done on a local basis, on a state level, rather than on a federal level. So it's important that we have an established network across different platforms. And with that all said, I could talk forever about our future plans, which involve an imminent press release that talks about the founding of the organization, leverages the number of individuals you already have as members through the Facebook site, and really lets the media know that we're here as a resource, that we can start talking to people about the things that we want to accomplish. I'd like to take a second to answer the first question that we got from the Google Plus question and answers. Please take the time to post a question if you have one that you'd like us to answer. And that addresses one of the things I hoped I addressed up front, which is this organization just for physicians? And again, the answer is no. While we do want the organization to very firmly focus on issues that we as physicians are equipped to address, that said, we're going to need allies that work with us on these issues to make sure that our agenda is really accomplished. And there will be positions on the board that will be available for both physicians and non-physicians if there are those that truly have, whether it's an expertise or just a particular passion on these issues, to help move the ball forward. So for those of you, again, that are not physicians, please, we ask you to send us an email to our Gmail account. That is pfcjreform@gmail.com. Again, pfcjreform@gmail.com, with the subject allies, to see how you can get involved. We've already started working with one of the medical students from the White Coats for Black Lives movement, a very powerful organization that was started at the grassroots level by medical students that felt that they needed to take a leadership role in this issue, and we're very proud to count them as a partner organization and look forward to working with them in the future. So please, again, medical students, physicians, non-physicians, attorneys, whether you're a publicist, there are going to be roles for all of you in the organization and seeing how we move forward. I'm going to take 2 seconds to just introduce our strategies that we've established for accomplishing our goals, and then I'll pause again for questions, and then we'll wrap up. So the strategy that we set forth as we were putting together the organization was, well, one was research promotion. As we started putting together our coalition and figuring out who it was that we could talk to on this, what we found was there's already a fair amount of research out there that's been done that look at things like Dr. Munyon were talking about transitions from care within correctional institutions to the outside, which we've already established a link with the Transition Clinic Network, which is very specifically working on these issues, amongst many other things that are directly health-related as well as related to the criminal justice system. And we want to make sure that that research is out there. We want to make sure that as politicians, as police officials, as judges take a look at how they can impact these issues, that they have the research at their fingertips. And we've made sure to publicize everything that we think is important on this. Along those same lines, we're looking at education and awareness of these issues. We want to make sure that both the public and the key players in the health and criminal justice system can access the research that we have, but also know that we exist and can read our press releases and contact members if they have questions about health issues that are related to the criminal justice system. It's also important, again, similar on the same lines, that beyond the public, that we speak with those that are involved with the criminal justice system and criminal justice reform. It just so happens that this is a hot button issue in the election that's coming up, and there is a momentum on this issue really that's unprecedented, but from both sides of the aisle, whether it's fiscal reasons or social reasons. Everyone that is on the national stage is looking at this and wants to find ways that they can have an effect. And we feel it's very important that we as physicians are at the table, that they hear from us, and that they can work with us as we continue to try and accomplish these goals. And finally, as I alluded to earlier, we are looking to partner with like-minded organizations. There are several organizations across the country, whether they're primarily health organizations or primarily legal organizations, or those specifically focused on criminal justice reform. We want to make sure that they know that we exist, that we, again, can give them the resources that we have, and then also that they can help us and let us know, hey, you know, this is a really interesting question that we have that we feel would be best answered by physicians. Could you guys research this? Could you issue a white paper that helps back up what we're trying to accomplish here? And using these strategies, we really think that now is really the time to make true, lasting reform in the criminal justice system. And with that, we're just waiting to see if there are any other questions from the audience about, again, what we're about. It's okay if you came in late and want me to briefly recap anything from whether it's our core issues to why we founded the organization to, again, how you can get involved. I mentioned for allies, you can get involved by sending us an email, again, at pfcjreform@gmail.com. Again, that's pfcjreform@gmail.com with the subject allies. For physicians, if you're interested in leadership positions in Physicians for Criminal Justice Reform, also send an email to pfcjreform@gmail.com with the subject leaders. We'd love to have you. We have a small core group that's been working so far, but there's plenty of work for everybody. We're also looking for some medical students that are enterprising and maybe interested in helping us with our social media page. As we age out, we're a little less savvy with the new things. So, if the youth want to help us get the likes that we need and make sure that the next generation is ready and willing to step up when their time comes, there's a role for you as well. So we'd love to see you. With that, not seeing any questions, I'll just let you know that this webinar is going to be available on YouTube from our YouTube page. So if you +1 our Google Plus page and add it to your circles, so that again we're able to communicate with you. You'll be able to view that. We're also going to link it to our Facebook page so that anyone that wasn't able to join us tonight, if you know someone that was invited or interested and couldn't make it, please direct them to the Facebook page where they'll be able to view the YouTube video and get a good recap of everything that's gone on tonight. I'd like to please plead with all of you to donate whatever you can, $5, $10, all the way up to $50, $100. We've seen an anonymous donation of $200, which truly floored me and struck me, as that this is really something that the people are very interested in. So whatever you have, you can help us reach our initial goal and surpass it. That's going to help this organization stay strong and be able to have a significant impact. And with that, again, if there are no other questions, we're going to go ahead and end the webinar for tonight. I greatly appreciate the time that you all have spent with us. We look forward to working with you all in the future because, again, this is the time to make lasting change on this issue. And with that, I'll say good night. Thanks again.